Hello and welcome. Having covered urinary devices, today let's cover fecal management devices. Fecal management devices help with patients who are incontinent, patients who have limited mobility and sensation. They help to keep the patient dry, to avoid skin breakdown due to exposure because of moisture. Now there are types, there are different types. Some of them are less invasive, some of them are more invasive. Now I'll just go over them. First is the bedpans. The bedpans, we're familiar with them back home. We know about the bedpans. So the only slight difference I would say is that most of the ones they use here are made of plastic. The ones back home are made of stainless steel. These ones are made of plastic. They also have those ones made of stainless steel, but it's more common to see these ones that are made of plastic, and they are more of disposable. When you finish with it with one patient, you throw it away. So there are two types of bedpan. There is the regular bedpan, and then there is the fracture bedpan. That one is used with patients who have limited mobility. Patients, maybe they have back injury, they had a fracture, so they cannot move as much as the regular patients. So that one is easier to slide under the patient. So in the image, you will see the two different types. The lower side of the bedpan for both, it's at the back, towards the back side of the patient. Then the higher side should be towards the front side of the patient. So that's how you apply it. Excuse me. And number two, also with the bedpans, there's bariatric bedpans. Those ones are bigger. They are used for bigger patients. Number two, bedside commode. Bedside commode is like you see in the image, is in form of a chair with a bucket inside. This one is used by patients who can at least move a little bit. They might not be able to move all the way to the restroom, but at least they can stay by their bedside. So that is what is used for patients like that. So for bedpans and bedside commodes, there are bedside bedpan and bedside commode liners that you can put inside the bedpan and the bedside commode. After the patient uses it, then it's easier to dispose of the fecal matter than just giving them the bedpan like that or the bedside commode to use. So with the liners, the liners have absorbent, something like tissue paper, but it has a high level of absorption, so it will put all those things together, make it neater to take care of. And some of those liners come with a scale. In case your patient is a strict I and O, you can use it to measure whatever it is, whether urine or fecal matter that comes out from the patient. But don't throw away the scale. So the scale is used together with the liner. Then number three, these ones, there is a drainable pouch that you can attach around the, you can put the pouch, the pouch has a wafer, you see in the image. You can put the wafer, attach the wafer around the patient's anal orifice, and then the fecal matter will be collected in the pouch, and the pouch is drainable. That means you can open it and drain what is inside. So that's another type. So these pouches, they come in different types. Some of them, it may not necessarily be a pouch. It may be something like a tube that you attach to a drainage bag, but you connect it to the outside of the patient's anal orifice. Now let's move on to the more invasive ones. Another one is the rectal tube. The rectal tube is just like you see in the image. A tube is just like a urethral catheter. You just put it in, and then the rectum is emptied, and then you remove it. It's just like using an intermittent catheter for urine. So it's just a similar. There are flexible ones. There are metal ones, and mostly it's used to relieve gas and fecal matter. Just, maybe the patient is gassy and the patient cannot pass it out, so you just put it in, relieve that gas and fecal matter for that time, and remove it. Then moving on, we have fecal management system. So this one is just like inserting a Foley catheter. So it has the tip has a balloon, and then at one end is a balloon, another end is a drainage bag. So you insert the end that has the balloon inside the patient's rectum, and then you inflate the balloon to anchor it in the in the rectal region. And then when the patient passes stool, it passes through the tube and into the bag, which is detachable. When it's filled, you can detach the bag and then throw it away and reattach another bag. So for this one, when you insert it, of course, you will lubricate it. You lubricate the tip that has a balloon. You lubricate it, insert it, then use sterile water, to fill the balloon, just like you will for a Foley catheter. But this time around, you use 45 mLs of sterile water. Put that in, anchor it in there, and then you can use the bag. It also has an irrigation port. So with the irrigation port, you can irrigate the rectum, so just so that things will not solidify and block the area. So you, from time to time, you irrigate it. You can also use that irrigation port to apply medication. And then those bags, that's the drainage bag, they come with a sachet that contains a gelling agent that has charcoal inside. So when you want to use it, you put those sachets into the drainage bag. They will help to turn the stool into a gel-like substance, and also control spillage and odor. So the charcoal inside will help capture the odor. So it contains that, so that it can help with spillage and odor. So the bags are replaceable, just like I said. The whole pack comes with the tube in itself. The whole system. They call it Flexi Seal. It comes with the whole system with the bag, but then the bags also come separately because you have to replace the bags. Then there is another one they call Cora Stool Management Kit. That one works the same way with this one I just described. You insert something into the rectum, it will drain it out into a drainage bag. But the difference is that this one is not anchored by a balloon. It has an indwelling device that is flexible. So that one does not have, the pressure that balloon will put around that area. It's not the case in this one. And this one also has a stool sample port, where if you need a stool sample, you can just take a syringe and aspirate the stool sample. Now let's quickly go over contraindications of using these invasive ones. If the patient has a wound in the anal area or a surgery, don't use it. If the patient bleeds around that area, specifically look out for patients that have liver disease. Their clotting factors are messed up, so they bleed easily. So don't use it on such patients. Then patients with large hemorrhoids, don't use it on them. Patients who are constipated, or you suspect they are constipated, don't use it on them either. And then patients who are allergic to the materials that is composed in all these invasive kits, if the patient has allergy to them, don't use it on them. So let's stop here for today. Thanks for listening. Make sure to like, share, subscribe, and follow for more.